everything is 6 degrees to reproductive health. And yet people try and shy away from it. People push it off and minimize that conversation.
Coming up on It's Not Human Sexuality.
Public health as a whole really takes to heart that service above self mentality.
Welcome to It's Not Human Sexuality, the show that goes beyond sexuality to reproductive health. Understanding the foundations of reproductive health allows you and the ones you love to make better decisions about your health, mind, and relationships. Joining us today is Grace Franklin. Grace, it's so good to see you, even if it's through Zoom. Thank you for joining us.
Thanks for having me. I'm excited to be here.
Well, this is so fun for me to introduce you. I met Grace when she was in the MPH program. That's the Master's in Public Health program I was teaching at the time at the University of Northern Colorado. She is now the Public Health Director for San Miguel County. And this is the county where Telluride, Colorado is. It's about 2 hours from Durango. With a Master's in Public Health, professional interests focus on community health and equity-focused strategic planning and project improvement. Her work in contraceptive access launched while interning for the reproductive health nonprofit Look Both Ways. After receiving her MPH, she worked for the Colorado Department of Public Health's Family Planning Program and served as a coach for Regional Institute for Health and Environmental Leadership. Do they pronounce that RIAL or?
Yep, RIAL.
RIAL? So the Advanced Leadership Training Program she's been doing for the last 2 years. She aims to create systems where everyone can thrive and ensure the most marginalized among us are heard and advocated for.
Welcome, Grace. We're so excited to have you here.
Woohoo.
Okay, so I have to reminisce a little bit. I'm not going to lie, I like to start out with that. But I remember meeting you when you took the graduate reproductive health class. Do you remember that?
I do.
I remember you. I can tell you where you sat. Okay, you sat to my. I'm facing the class, so it was to the right of the classroom, and everybody always sat in the same places. But you were really fun because you were really inquisitive. Like you would get this look on your face, and you'd ask a question, and I would explain it, and you'd still look at me like, okay, and I'd think, I wonder, was that a good answer? But you would take notes, you'd write it down, and then you'd ask another really great question. So I was like, oh, she's just processing. This is really great. And I used to say in class, all roads lead to reproductive health. Do you remember that?
I do. Yep. Very formative.
And then the class didn't believe me, so I would get up and I'd draw a diagram about how all these umbrellas lead to reproductive health. And that's kind of the path you took after you graduated, right? You went definitely into reproductive health, contraceptive access. But before that, because she was in my class, she did an internship with Look Both Ways. And I want you to just briefly tell us what that experience was like for you, because I know at times it was disappointing.
Yeah. Whenever I think of you, I think of specifically of you talking about me being inquisitive in class. And sometimes I'll be in meetings writing notes, and I'll have this moment where I'm like, oh, I'm pulling this moment in the reproductive health class where I'm just like super laser focused. So that's one thing that whenever I think about you, that's one of those like major like moments that I recall. But the other big one that I remember, it's just reproductive health. I feel like you said, it's 6 degrees to everything is 6 degrees to reproductive health. And yet people try and shy away from it. People push it off and minimize that conversation. And it just can be so frustrating when doors continue to shut. And I just remember coming to your office once and being very just like let down and unsure of how to keep going forward. I'm just like, how do you keep doing this day by day? And you're just like, you have to, right? And it was just one of those perseverance moments where even if you don't get that yes right away, or certain avenues don't open up, there is a pathway forward. And by asking and persisting, that's how you continue to advocate for reproductive access.
Right. And I remember that day clearly. You were very defeated that day because you were out raising money for a conference that you were orchestrating for Look Both Ways. It was a pregnant teen conference.
It was such a cool
It was
conference.
it was one of our best. And you sat down, you said, how do you do this every day? And I said, because sometimes a door opens, you know, and you go, okay. And I said, you got to stay the stay. And so you did, right? So then you started doing your training with the Regional Institute for Health and Environmental Leadership. I'll be honest with you, I didn't know you were doing that, but I'd like to hear more about that.
Yeah. So, RIHEL is a public health focused leadership program, really to challenge and build a foundation for strong management and leadership with a health equity lens. And I know for me, coming straight from grad school, I went into a really amazing role in public health at the state level for family planning, when a lot of different opportunities opened up there as well. But it was always this, how do you ask these open-ended questions, these powerful questions to get to that next level, whether it's in relationships, management, or like you said earlier, opening up different doors. And so really it was a lot about how do you build relationships that are meaningful, ask questions, and listen really strongly, which has really just helped me throughout my career path over the last bit. RIHEL, it really dovetailed into this executive level leadership coaching, where again, it's that concept of asking open questions, really being inquisitive and listening. And especially coming into my new role as the public health director in this small rural community in the southwest of Colorado, I came 2 weeks before the COVID health crisis.
Right.
And so did not know much about this community, did not have that trust, and was still really learning about communicable disease as well, since this has never been my wheelhouse until now. And so just having this foundation, as well as doing all these different challenges and projects along the way, it really did set me up for success to really build trust in a very quick way, which I don't think is an easy task.
Definitely not.
Yeah.
And for our listeners who don't really know how small this community is, it's about it's a population of about 2,200. Is that right? And maybe that population expands a little bit during your ski season and your summer season, but I'm guessing it stays somewhere around 2,300, which is tiny, you know?
It's
And,
really
and
small.
people, I know I grew up in Alamosa and the population was 3,000. I can tell you how tiny that is. Or actually it was about 7,000, and that was tiny. I mean, it's like being in a fishbowl. And here you are, the director of, public health. And that was a big deal.
Mm-hmm.
Did you feel isolated?
Yes and no. Being in Fort Collins and Denver for the last 7 years, I had a really strong friend group and just community that I built. So mentally, I was geared up for a level of isolation, knowing it takes time to build meaningful relationships. So I think I was actually just personally prepared for this in a different way because I was expecting not to make friends. Fast forward a year, I've made some friends, but I'm definitely ready to meet more people because it's definitely hit that point of like, okay, it's the next step, right? But it was a different level of isolation.
Well,
That'd be a hard time to have just moved to a new place. I would have struggled with that.
I'm not sure I would have. I'm the forced extrovert. So, but you do love the outdoors. And I think that that's a big draw for you. And I know that when you were interviewing for that position, I was just crazy telling this guy, if you don't hire her, you're crazy, because, I would have kept you with Look Both Ways if we could have afforded you. When we win the lottery, I'm going to try to steal you away and get you back to Look Both Ways. So we can do good things
Gladly. Yeah. The
Well,
mission of
don't-
Look Both Ways is amazing. So I can get behind that any day.
Well, thanks. We're still plugging away. We're trying to get the curriculum still in schools. We have one teacher that's now using our textbooks, so we're pretty excited about that. What do you think, going through the master's program, and you're one of the, I don't keep in touch with a lot of students, but a fair amount. And a lot of them aren't in public health. You know, they got their master's in public health, but they're off doing different things now. And so you definitely have stayed in that vein. It was something that you wanted to do. But what was your undergrad in? I can't remember.
It was conflict resolution. Random, right?
Oh.
So social studies.
But, you know, I think that could serve you well in a public health setting for sure.
I didn't know that was an undergrad
Absolutely.
degree. That's
Yeah,
conflict resolution. I love that.
I do too. But you've stayed the course. So what do you remember about your program that you said, this is it, this is my calling, I really want to be in public health? Because if anybody knows anything about public health, it's a tough gig. It's a lot.
It is a tough gig. I think public health as a whole really takes to heart that service above self mentality. There's definitely that need for self-care, of course, and to take care of yourself. But it draws people who have that community-minded approach, that want to have that much more mission-oriented career path. And so I know for me, growing up, my family was very much into community work, very big on volunteering, and that they really instilled that baseline. And then coming to the MPH program, just seeing people who were extremely passionate about specific topics or issues, and being able to really have these larger systemic approaches to addressing it, not just one-off projects or things that feel good, but these long, gritty 20-year grinds to really make a difference that impacts people's lives. That was inspiring, and I really think is that motivating factor to keep going too.
Sure. And being the director, even though it's a small community, you're still the director. And so you have to make decisions for the township that you're in, right? And some of those decisions, I'm guessing, are not always popular.
I've come to learn, this has taken a long time, but I will never make everyone happy, and that's okay. Because if you stick to your true north of what is that bottom value, and for me in public health, it's preventative care and keeping our community healthy, regardless of the people on both ends, it'll be okay, and we'll stay true to our approach.
Right. Yeah. For the greater good. For the greater good.
Mm-hmm.
Yeah, you got to have some thick skin to do what you're doing. I'm assuming.
Thick skin or something else.
Well, Grace has such a great disposition as far as sort of we'll just roll with that.
Yeah.
Just move on to the next conflict or the next agreement, whatever. What do you think is your next big thing that you're going to be working through where you are now?
Oh gosh. Someone asked me, they're like, where do you see yourself in 5 years? I was like, oh, I just want to see myself in 2 years. And so, yeah, public health here is really fascinating. Reading literature about mountain communities in Colorado is one thing, and then living it is completely different. But access to healthy services, whether it's affordable fresh food or affordable housing, is really lacking here. And I think it's easy when you're from a distance to minimize it and be like, oh, you could just drive to Montrose, which is an hour and a half drive. No big deal, right? But it's not realistic. And then a lot of that social determinants of health, how people live, work, play, really key into mental health and behavioral health. So there's already a need to expand and better support all of the great work that's been occurring in behavioral and mental health in our county. But with COVID especially, it's compounded and has become even more so an area that we can really focus on and make a huge impact for.
Definitely. I think, you hit on some key notes there. One of them is affordable housing. It's not just Telluride. I mean, we have issues like that in Aspen and Vail, and where the people who actually work the town, that keep the town moving, that keep the resorts moving, can't even afford to live there, And I don't know if that's the same kind of experience, or if you're just sort of working off of the fact that there just isn't enough places to live. In your situation, that might be both. Yeah. Right. Because you're about how far are you from Durango? About
2 hours.
2 hours.
2.5 maybe. Yeah.
Depending on weather, right?
Yeah.
So that's probably Montrose. So you're sandwiched somewhere between Montrose and Durango. And they're bigger, but probably have the same issues. Maybe not as bad in Durango because of the university. I can't remember if Montrose has a university or not. I don't think they do. I know Mesa does, but yeah. So how do you think that can be fixed?
I don't know. No, it's a big juicy problem. It's a long, hard road ahead. There's a lot of really great work already being done, but it's really how do you bring it together and make it a more coordinated effort? How do you better have coordinated communication so folks know about services? And then to your point about being in this like interesting hub where we're remote but also somewhat connected to places, how do we better leverage these regional partnerships to also maximize what's already going on in Montrose and Durango so we don't have to reinvent the wheel?
Right.
Yeah. So it's complex because there's no one golden answer.
Right. How big are the schools there? The K through 12.
Small.
What kind of services? Like we're always talking about. Me. I'm all about access to contraception, access to reproductive health information. I mean, growing up in a small town, we had a very high teen pregnancy rate. They said, "Oh, well, we have to bring in Planned Parenthood," so they put Planned Parenthood on Main Street where all the parents work. Brilliant. But anyway, so what do you see in that realm?
Yeah, lots of work to be done there too. From the public health perspective, the local public health agency that I now work with, we used to hold a family planning space where we had contraceptive access and sexual health education. But this last year, we let go of that grant. And really, for me, I asked for support from the Board of Health to back our 2 current medical centers to better train their staff so they can have culturally competent, comprehensive contraceptive conversations with their patients. That's a tongue twister.
For sure.
As well as accessing whatever contraceptives people want. And so the board approved a budget of $32,000 to get divided between the 2 to move this forward in a place that is more appropriate and is not on Main Street, which our office is. So funny that you say that.
It's kind of funny, but it really kind of isn't, right? So, I mean,
who's going to go there? Like,
nobody.
My mom's going to see me.
Well, especially in a small town, people talking and go, "Hey, I saw your daughter go into Planned Parenthood. What's up?" And
to be fair, we do have an alleyway, so you can go around the back if you don't want to be seen. But I'd rather it be, get your care where you're getting care. Yeah.
Yeah. And what about the classes? Are they teaching any type of health education in classes? Or
there is some healthy relationship work that gets that's put on through our resource center here in San Miguel, but there's definitely a lot of opportunity for increased education and conversation around reproductive health.
I was just about to turn to Mandy and say, "Hey, we'll go down. We'll do some professional development for your folks. Be glad to do it. Love to do it. You know me. I'd love to do it. We'll send you textbooks. We'll do it. Let's set a date."
Yeah. Last time we talked, there was textbooks galore, and you were just very welcoming and opening and giving. So
yeah,
I'm
there
for
still
it.
are. We have our second edition out, where I'm getting ready to probably look at it one more time and probably change a few things. But all this stuff a lot of it's the same: anatomy, physiology, and contraceptions and how they work. And that doesn't change much. No, it doesn't. Language changes, though, has changed a lot. So are you glad you did this?
I am. I think every once in a while there's been some pretty low lows, but even during those moments, I wouldn't trade it.
Yeah, here's a news flash. That's forever. when you're in public health and when you're trying to. Did I burst her bubble? I didn't mean to do that. But
I don't think Grace's bubble can be burst. Look
I don't
at that
either.
face.
I know.
Yeah.
She's always so cheerful. Well, is there anything that you think we should know? Like what do you think our listeners should know that's really important about Mountain Town and public health, other than, I mean, the obvious of things that are being shut down or things that aren't being paid attention to, or, as somebody who visits a mountain town, what advice do you have for visitors and tourists?
That's a really good question. This is something that, as somebody who was visiting mountain towns, being somebody who lived on the Front Range, I definitely always knew people lived there, right? But when you're in vacation mode, you're in vacation mode, and it's definitely a different hat. And it is really interesting to see from a human behavior standpoint what sensible things get turned off when you do enter vacation mode. So I would just ask, people to be kind and patient and just really humanize whatever experience you are doing, whether it's a guiding tour or you're walking down Main Street.
Oh, I so hear that.
Yeah.
I so hear that. Yeah, there's that. There is that. It's sort of what we often can say, the ugly tourist, right? That just can be too demanding or just not patient, or, take a look around you. People are,
This is my vacation.
yeah, and I want margarine, darn it, not butter. So, stuff like that. And I think that's a really important distinction. It probably makes you look at people a little bit differently.
Absolutely. And I would say there's a lot that isn't seen in mountain communities across the board that's churning underneath the surface, which I think is everywhere, but it's just very much expanded here once you see it.
Sure. Do you walk down the street now and people recognize you?
It's hard with masks and beanies and a long jacket right with your hood up right now.
Nobody can see anything.
She does that by design, right?
So occasionally, it is really interesting though.
I know that jacket. Oh.
Oh yeah. It's great. People recognize my dog more than me, and they'll be like, "Oh, I
there
saw
you
you
go.
walking your dog." So yeah. But folks are friendly here.
Yeah. Oh, yeah. I can imagine.
Yeah.
Like I said, I grew up in a small town, and then our cabin is in southern Colorado, and we go to Creed, which is like a population of 300. So, everybody definitely knows everybody. But I think there's a lot to be said for that. And I, for one, am just really, really proud of you and just glad to know you and glad to see that, you're really making it happen. And it's cool.
Yeah, it is
Mandy
cool.
and I, we've worked with you, and we're just really, really proud of you.
Thank you. I feel the proudness. And I would really I'm so fortunate. And when I think of privilege and everything, just to have such strong female mentors in my life that say, you are capable, you can do this, I am proud of you. That's what's really of course I'm cool too, but that support has really lifted me up to be able to reach and stretch myself. So thank you too as well.
Oh,
Oh, our pleasure.
There really is something to be said for having female mentors when, Betsy's a mentor of mine as well, so that's,
Absolutely.
I get it from that perspective as well. Cause
Thank you.
Well, yeah,
yeah, that's because I'm old, but
Wait, 60 and sassy.
yeah, there it is.
Oh.
People always go, "You don't look 60." And I go, "I know, I look 70."
No.
that is so not true.
I know, I'm just kidding. But it's so funny when people say that. It's like, oh, well, but I don't even know what that looks like. It's just a number.
It is just a number.
But you're right, Grace. And we do stand on the shoulders of others. And I stood on many a shoulder. And so it's always fun to definitely pay it forward.
Absolutely.
But I want to thank you for your time with us today. It really does me good to see you and to see you flourishing and doing such a great job. Because I gotta tell you, I Google you and I listen.
No.
I read those articles. Right,
Oh,
you're holding your
no.
own. I'm keeping my eye on you.
These are some good warm fuzzies.
Yes.
Oh.
And it was really good to see you. I haven't seen you in years. Since
it's been
since near
3
that conference at least.
Gosh, for sure. But thank you for your time and keep rocking it.
Woohoo.
And when I win that, lottery and we have a ton of money, I'm gonna call you.
In a heartbeat, I would say yes. So.
All right. Do you have anything else you'd like to say?
No, I just miss you both, and thank you for thinking of me. This is truly an honor to get plugged into this. It's been fun listening to you all as well. So
yeah,
it's great to have you on.
Yeah. God, she's always joyful.
Yeah, she never see her without a smile on her face. And I mean, I know that she's had hard times and all that stuff,
for sure.
but she really does just radiate that cheerfulness and joy.
I know. Yeah.
Very cool.
It can't be easy, right? You're in a small towns are they can be so amazing, and they are, but they're kind of a tough nut to crack, right? Because you're an outsider.
Yeah, it's like a clique. A whole town clique.
There's some high schools that are bigger than that.
Oh, yeah.
I know, right?
For sure.
So
I've never lived in a small town, so I don't really know anything about that.
I think everybody should have to do that just once.
I've always been a Denver suburbs girl until I moved to Northern Colorado. So
yeah,
I lived in Berthoud for like 6 months. Does that count?
No, because you're not isolated.
I know you're not isolated. It's too close to everything.
Yeah. Sorry. Wrong answer.
Okay.
So it was good to see her.
It was really good to see her. I didn't realize how long it had been, but.
Well, she was really one of our top interns for sure. She really made it happen.
Yeah.
That conference that she orchestrated was our best.
It was by far our best. I mean, we didn't necessarily have the best attendance at that one, but it was the most. We had pretty good ones. That was
the one we had the most attendance.
I was confusing it with the other
campus, not the one in Denver.
Yeah, I was confusing the ones. Yeah, that was a really good one.
Yeah.
She had set up everything we needed, and
it was for pregnant teens and pregnant moms.
Yep.
Yeah, it was good.
Wish I had her back.
Yeah,
helping us with all the stuff.
We're gonna take her up on that. Go down to Telluride and do some professional development.
I think that would be great. This podcast was created to promote Look Both Ways and the textbook written by Dr. Cairo. Look Both Ways is a nonprofit organization based in Loveland, Colorado, with a mission to educate our youth about their reproductive health to make informed decisions for their future. We do this by educating the educators through professional development, and we also put on free conferences for both teens and parents of teens. Textbooks used in schools are donated by Look Both Ways to eliminate the money obstacle for schools interested in piloting or adopting our curriculum and textbook. As a nonprofit, we are always fundraising and accepting donations. For more information about Look Both Ways, our fundraising efforts, getting a textbook donated to you, or to make a donation, please visit us at lookbothways.us. This podcast was produced by Peach Islander Productions in Fort Collins, Colorado.
This is Dr. B.
And Mandy Johnson wishing you well.
Be sure and catch all our episodes of It's Not Human Sexuality on Spotify, Podbean, even iHeart, or wherever you get your podcasts. And it's like, God,
sorry. Nothing's even funny. I don't even know why we're laughing.
It's just that time of day.